During one of our weekly hospice meetings, the discussion turned to the burden of finding an opening in a facility or a nursing home or an assisted living for one of our patients. Mr. A belongs to the working poor segment of our society, just above official levels of poverty, and yet he cannot afford health insurance and primary care, let alone the private cost of an assisted living center or nursing home. Our patient is still living at home, has no family support, and definitely is in trouble. His progressive cancer has caused an inability even to do activities of daily living such as bowel and bladder care. He now only has Medicaid, and his hospice nurse and social worker are not able to find an assisted living center or a nursing home that will take him. It's no surprise care facilities in South Dakota try to avoid Medicaid patients like Mr. A, because here Medicaid pays so poorly that facilities lose money when caring for them. If a nursing home has too many Medicaid patients, it simply can't stay afloat. This explains why nursing homes, especially in rural areas, are closing. The national solution was to expand Medicaid coverage to increase payments for services using federal dollars. Some states initially elected not to expand Medicaid for fear they would become dependent on this money. However, many states have changed their position, and to date, 36 states now accept the national funding from expanded Medicaid. South Dakota and Wyoming are among the 14 which, so far, do not, but Wyoming is working on it. North Dakota expanded Medicaid in 2014, as did Nebraska this last year. If Medicaid was expanded in South Dakota, more than $2 billion of federal health care funding would come into our state, helping health care coverage to 55,000 South Dakotans, in turn helping to prevent rural nursing homes from closing. Also, this would help Mr. A and people like him get comfort care during their dying days. Medicaid expansion passed last year in some majority Republican states, indicating that this is a bipartisan issue. A recent poll revealed that approximately 80% of South Dakotans want Medicaid expansion. In my opinion, fearing dependence on federal money does not justify letting our rural nursing homes close or letting the working poor go without support. It is time for those within the political arena to expand Medicaid.